Hi, everyone. Just want to tell you about Lisa, a 38-year-old mom of two, came to see me in the office. She was a lot like a lot of my patients. She was exhausted, bloated, constantly battling gut issues. She'd really tried probiotics, fiber supplements, and kind of every gut healthy diet that she could find, either from advice from doctors or on social media, whatever. But nothing really worked. And so, what was Lisa's biggest struggle? She felt like she tried to eat, but she felt uncomfortable. She started her mornings with a quick snack, usually something like a bar, something that she could find, and sipped on lattes all day and grabbed late night treats after putting the kids to bed. It seemed like her gut never got a break. And so I suggested, when she saw me, I'd seen her once before many years ago, but not for this problem. But when she saw me, I told her, "Hey, listen, let's try a simple change: an overnight 16-hour fasting window from 7 p.m. to 11 a.m." Uh, I told her not to try any extreme dieting, no supplements, and just kind of allowing her whole system, her digestive system, to rest. So then I had her follow up in about 2 weeks. So within 2 weeks, her bloating was reduced. She even slept better. She didn't talk to me about that in the beginning, but when she came back, she slept better. And most importantly, she felt like she really had her energy back. The fatigue that she had, like, the kind of like no energy. Uh, she had her energy back. And over time, she extended and continued this 14-hour fasting window. And she reported kind of a more of a focus, a sharper focus, decreased kind of inflammation, and even lost some weight without trying, which was really is great for her, because she didn't tell me that, but she's been trying to lose weight for a while without success. Now, at least the story, I use that as an example, but it's not unique, and lots of my patients really have some similar problems. And today I'll show you kind of exactly how what I did with her, what exactly was happening, and how you can do it too. We'll dive into kind of one of the most fascinating areas of health research, which is the relationship between what I recommended for her, intermittent fasting, and gut health. Right. So intermittent fasting, what is it? It's more than just a weight loss strategy. It's really a powerful tool. Lots of my patients use it, and lots of people ask me about it. And it's a powerful tool that can reshape your microbiome, strengthen your gut lining, and overall, it can boost your overall well-being, right? Not just strengthen your gut lining, but you can get more energy, less fatigue. So let's today break it down, see how it works and why it matters. So first of all, intermittent fasting, or IF, is again not just a diet, right? It's a it's a way of eating that cycles between periods of eating and fasting. So they're pretty common fasting schedules. We call it 16-8 method. So you're fasting for 16 hours and eating within a 8-hour window. The 5-2 methodology, eating normally for 5 days and then restricting calories for 2 days. Then people who have the 24-hour fast, going without food for an entire day, once or twice a week. So now, how does this really help or affect the gut? Right. So when you take a break from eating, your body isn't just resting; it's actively, let's say, repairing itself. And this is where intermittent fasting can become a game changer for your gut. So, how is it that intermittent fasting can benefit gut health? So, fasting can boost the gut microbiome, meaning that it can make it more diverse. You have different types of the stuff in your gut microbiome. As a reminder, remember, the gut microbiome are the trillions of bugs in your intestinal system, like bacteria, fungi, viruses that can really help your gut, or if it's the wrong combination, can hurt it. So what happens is that when you fast, you give your gut bacteria a chance to rebalance. So when you have intermittent fasting, you can actually encourage the growth of beneficial bacteria. And fasting increases the levels of a particular type of bug that's called Akkermansia muciniphila, and that's a bacteria that strengthens the gut lining. Remember, the gut lining important. So on one side is poop, one side is blood, and so one cell layer and a couple of mucus layers are what is separating them. So you want that gut layer to be strong. So this Akkermansia actually helps to strengthen the gut lining. And then The intermittent fasting also reduces the bad bugs. Constant eating allows inflammatory bacteria to thrive till you get more plentiful. So fasting starves these harmful bugs and helping reset your gut. So I would think of it this way, right? Fasting is kind of a like pressing a reset button, and who wouldn't want that, right? So that's the first way that your intermittent fasting benefits your gut health. The second way is that fasting strengthens directly the gut lining, right? The healthy gut lining is essential to prevent leaky gut, a condition where toxins and really undigested food particles, little tiny ones, can enter the bloodstream, triggering inflammation. So when you increase the mucosal lining and you increase the gut wall strength, that helps protect the gut from harmful stuff coming through. And it enhances something called autophagy. So autophagy is a natural cleanup process where damaged cells are recycled. So it's a way for your body to get rid of the stuff that's there, so you can have kind of a renewal of sorts. So think of autophagy like a self-cleaning oven, right? Imagine that it removes all of the damaged cells, all the damaged stuff, and then leaving behind kind of a healthier gut environment. The third way that the intermittent fasting actually changes the gut or affects it is that it reduces inflammation in the gut. Inflammation, remember, is a root cause of many chronic diseases, including irritable bowel syndrome, Crohn's disease, and even something that I'm really passionately talking about now called neurodegenerative disease, like Alzheimer's. So by fasting, you can decrease the production of something called lipopolysaccharide or LPS, and this is a harmful toxin that can really wreak havoc on your gut. So when you look at intermittent fasting, you find that it reduces kind of the markers linked to inflammation and linked to gut diseases, and it improves your immune function of your gut. Remember, the gut has the most sophisticated immune system in the entire body, so it really helps to reduce invaders from coming through and enhancing your immune system. And I'll tell you that studies have even shown that even a 24-hour fast can significantly lower gut inflammation. So imagine if you don't just do it one time, what regular intermittent fasting can do. The fourth way that the intermittent fasting can affect your gut health is it enhances digestion and nutrient absorption. So giving the digestive system a break is interesting. It reduces, you know, uh, symptoms like bloating and gas, improves insulin sensitivity, and that helps to regulate metabolism and gut function. So you're by giving the gut a break, you're helping with that. It also stimulates something called short chain fatty acid production. So short chain fatty acid production is critical. So examples are butyrate, and that helps to fuel the gut lining cells. Remember, I talked about the gut lining. You really need for it to be strong. So imagine analogy would be like it's like a busy highway clear out right before rush hour, right? Your gut kind of gets a break before the rush hour. The digestion comes in, and it makes digestion more efficient. Um, so how can you, if you think that this is something that's useful, how can you use intermittent fasting for a healthier gut? You can maybe start with a 12-hour fasting window, maybe 8 p.m. to 8 a.m., and then increase gradually to 14, 16 hours. Remember, really important to hydrate, right? Drink water, decaffeinated drinks, or other forms of hydration that you want. Water is my go-to, so I pick that. And then remember to break your fast, not just with a bunch of junk food, but gut-friendly foods. My favorite are things called fermented foods. Now, fermented foods already have the good bugs within them, right? Things like I like yogurt, I like kimchi, I like kombucha, so you can break your fast with that. A prebiotic fiber is important, like with bananas, onion, garlic, and try to also have healthy fats. So my favorites are avocado. I had an avocado just a little while ago, and olive oil. And avoid the ultra processed foods after fasting. It's really important. So try to avoid added sugar, refined carbohydrates, like not a candy bar, not a bunch of chips, right? Or processed junk food. They can then you break your fast with this, it disrupts your gut bacteria, right? So when you really have intermittent fasting, it's almost like it's not really like deprivation. It's about giving your gut the time to really heal and thrive. And so that's super important to understand. So in summary, intermittent fasting can improve gut health, really affected positively by balancing the microbiome, right? Reducing inflammation, strengthening your gut lining, and improving digestion. So by making these kind of tiny changes, like fasting overnight, using gut-friendly foods, you can really experience better digestion, better energy, and even enhance brain function. A lot of my patients have benefited from that. So when you look at all this, you think to yourself, am I ready to give my gut a reset? I think it'd be a good question to ask yourself, right? And if you're saying yes, hey, try just even maybe start a simple 12-hour fast even tonight, see how you feel in the morning and let me know. And you can send me a message too. Uh, and remember, it's like you have to make small changes every day and it can lead to big results. I'm Dr. Nandi, and remember, it takes guts to heal your body.